Nice to meet you.
You too.
And I've had OCD since I was a teenager, like when I was 14 or 15
Okay.
years old, and I was hospitalized 3 times when I was a teenager, and it didn't do anything to help me. And one hospital stay I had was for 6 months at Forest Hospital in 1978, and they ended up making me worse. Actually, my parents eventually took me out of the hospital.
Mm-hmm.
And the last time I was in the hospital was 1981. And throughout the 1980s, I just saw a psychiatrist. But I didn't go that often because insurance only, there was high deductibles and
Right.
limited visits and stuff, so I only went when I really had a problem. And that was really up until the early 90s. And I've always been struggling with my LCD. It's always been like a roller coaster
Up
of
and down.
peaks and valleys all the time. And I was seeing an OCD therapist in Naperville, and she was helpful. Then in 2008, I had a really severe OCD episode, and I felt like killing myself, and I'd even written a suicide note. And I went and saw my therapist, and she knew that I needed more help, but she knew I didn't have enough money, so she referred me to the health department in DuPage County.
Mm-hmm.
And even though she wasn't an OCD therapist, she wanted to learn all about it, and she helped me a lot. And the services there were free, and I was seeing her every week. And for the first time in my life, my OCD was stabilizing to like hills and small valleys.
Mm-hmm.
And I'm currently seeing an OCD therapist, and she's not charging me any money. I've known her a long time,
Mm-hmm.
and she wants to help me, and she's been helping me a lot. And it was last year, or last summer on the news, I saw that they were closing half the mental health clinics
Mm-hmm.
in Chicago, and I read that the state of Illinois cut $187 million in the last 3 years for the budget for mental health service.
Yeah.
And I really felt kind of upset about that because I've been struggling with getting services for myself up until only recently.
Let me just, because I'm on the Board of Health,
Mm-hmm.
so I actually oversighted and we refer to it as consolidation as
Mhm.
opposed to closing.
Mm-hmm.
Because, and in fact, I've been on the Board of Health through 3 commissioners of health, and I have advocated to all 3 commissioners of health that they needed to do something to consolidate those 12 clinics down to 6.
Mm-hmm.
Because, so for example, the Woodlawn Mental Health Clinic was understaffed, underutilized, because if you
Mhm.
go drive through Woodlawn, it's essentially a bunch of vacant lots waiting for the University of Chicago to regentrify it,
Mhm.
so they can really be super special.
Mm-hmm.
And so they were wasting money.
Mm-hmm.
So what they did was they consolidated Woodlawn with Inglewood so that the patients could catch a 63rd Street bus, go to Inglewood. And so all of the therapists that were at Woodlawn and all of the patients at Woodlawn are now at 63rd, and their services were not decreased
Mm-hmm.
in Chicago at all.
Okay, that's good.
The other thing that was done, although the mental health advocates don't see it this way, and they're advocating, so I don't know that they want to see it,
Mm-hmm.
but the city of Chicago also transferred all of the patients with benefits to the comprehensive community mental health center so that they could bill, which the city does a bad job of. And the city kept the indigent patients
Mhm.
so that they could continue to see them and take care of them. And they actually did a very good job of transferring the people that had ways to pay to the comprehensive mental health centers. And they took 3 months to do it, and they've tracked every single person to make sure nobody got lost.
Okay.
2 other examples. One is, there was a mental health clinic at Roseland, which was a block away from a comprehensive community mental health center called HDR, 1 block away
Mm-hmm.
in the same neighborhood, Roseland. And in fact, HRDI used to do the aftercare, the pre-care, a lot of the services, because the city clinics really sort of have what I refer to as drive-by psychiatrist
Mhm.
and maybe a case manager, and that's kind of all.
Mhm.
While the comprehensive community mental health centers have emergency services, psychiatric services that hopefully are not drive-by, housing, residential, day treatment, child's therapy, adult psychotherapy. So they're much more comprehensive. So so I actually think, and the third thing, which is better, is that Cook County is doing something called county care, because they went into the federal government and asked for an early startup for the Affordability Care and Patient Protection Act. The plan being there to insure more uninsured people. And there are 300,000 uninsured people in Cook County. And county care is, Cook County systems, healthcare systems, is getting ready to insure 150,000 of those 300,000 people that are uninsured and provide them outpatient services. I have always been of the opinion that the Chicago Department of Public Health needed to do prevention as opposed to direct care.
Right.
And Cook County should be the direct care people. I don't know if you're aware, but there's a ton of prevention science.
Okay.
And I guess the question for somebody like you who's already afflicted with the OCD is whether or not, if you had been treated and identified as having problems early on, if you could have been strengthened
Right.
and nurtured and supported in a different way than being sort of, and I don't know, maybe you weren't outcast, but my experiences in most people with mental illness are kind of outcast and shunned, and everybody avoids them, and, stigmatizes them.
Yeah, I always was afraid of the stigma of mental illness, but I'm getting less of it. Today, as I'm telling my friends about it, I'm finding out that there's no reason to be ashamed.
I wouldn't think so.
Yeah, because every time I tell my friends, it's been a real positive thing.
Sure. So it seems to me that if we could do a better job of early identifying people, because you said you got clinically ill at 14?
14, 15, yeah.
But you didn't get any help till?
Like help for my OCD, I didn't get any help till probably 1997.
So how old were you?
I was born 60, so
30 some odd
yeah,
years?
30 some years.
So your whole path might have been different
Exactly.
if you'd have been identified earlier and strengthened and given more strength-based kinds of things.
Right.
So that's what I've been pushing. I've been pushing a prevention,
Right.
strength-based, resiliency-based public health conversation, which I think needs to be housed in the Chicago Department of Public Health as opposed to them delivering services. So I was actually in favor of the consolidation
Oh, okay.
of the clinics. Now, the state of Illinois, on the other hand, for example, I used to run the Community Mental Health Council, which was a $22 million comprehensive community mental health center. It did great work. And the state of Illinois didn't give us a contract in FY13, so it essentially died. Although some people would say that it was assassinated by the state of Illinois. And then the beloved Governor Quinn, when asked about it, said that he had a lot of respect for Dr. Bell and the Community Mental Health Council, but he had concerns about fiscal mismanagement.
Yeah, I remember watching that on the news.
It's like saying I stole the money in a subtle kind of a way, when really the reality is they didn't pay us on time.
Yeah.
And so that's what killed us. If we'd have had some money, then I might have been able to mismanage it, but we didn't have any, so that was the problem. So that is, they have cut services. And of course now, his new mental health advisor, Lori Rickman Jones, and they came up with $25 million. Wonder where they got that from. Maybe it's from the Community Mental Health Council's money, but they don't know what they're doing, so it probably won't work.
Yeah. And you ran that clinic for 37 years?
37 years.
What happened when your clinic closed? How did that affect the community?
Oh, it was very, very stupid. And the reason it was stupid is because, and I should lighten up a little bit. The state of Illinois did help us, so I'm not really mad at them. They told us they were going to pay us through the entire fiscal year of FY12. And because they told us they were going to pay us, myself and a number of our staff used our personal money
Mm-hmm.
to fund state services because we thought we'd get it back
Mm-hmm.
when the state finally
Right.
paid us what they owed us for work we did. Well, I guess it was the first day in June, they told us they weren't going to give us a contract. And we tried to say, well, okay, can you give us some money? Because we are treating 26,000 people,
Mm-hmm.
and we cannot transfer them appropriately and respectfully and ethically in a month.
Mm-hmm.
As I've told you, the city of
Yeah.
Chicago took 3 months to transition people. So we
Mhm.
asked for funds to transition people, and they said no. So we abruptly sort of closed June 30th. I had 1,000 patients scheduled from July 1st to August 12th. We looked in our computerized records to try to find phone numbers, but we only found 70
Mm-hmm.
out of 1,000. These were seriously chronically, persistently mentally ill people that needed medication, poor people, just had enough money to maybe get from home to me and back home,
Mm-hmm.
hopefully with their medication in it.
Yeah.
So I decided I couldn't ethically, morally, intellectually, or emotionally just drop those people like a
Right.
bad habit,
Right.
like the state of Illinois did.
Mm-hmm.
Although the state of Illinois maintains they transferred them, but I know that's not possible.
Right.
Because their records were just as bad as ours in terms of phone numbers.
Right.
So I stayed in the building and saw people from July 1st to August 1st, but then the board wanted the building closed because the insurance in the
Mhm.
building had run out. So I rode my chair outside and saw them outside on the sidewalk.
Yeah, I saw that on the news. I was watching it on the internet.
You know, that's what I do.
And I said, meeting with somebody in the car.
Oh, yeah. The guy had a car.
Yeah.
So I saw him in his car. I finally stopped at the end of August, even though I probably may have missed maybe 20 or 30 patients out of that 1,000 that I was
Mhm.
supposed to see. Probably saw about 500 or so. I don't have a clue as to whether the state contacted
Mhm.
people and they didn't show, or they heard that we had closed on the news and went somewhere else. I have no idea what happened. It was a chaos, it was a mess. But I had to stop seeing people at the end of August because the electricity went out.
Yeah. Wow.
So I couldn't get records, so I didn't know what medicine anybody
Yeah.
was on.
Almost 2 years ago, I lost my job. I was working as a pizza delivery guy in the suburbs, and my boss was just a real tyrant. I hated working there, and when he fired me, I was actually kind of relieved, but I knew I was going to be in terrible financial shape because I was
Sure.
making good money there. And then he called me like a week later and told me I could have my job back if I wanted it back, and I said, no, I don't want it back.
Yeah.
I got another pizza delivery job, but it wasn't paying me quite as much, so I lost my apartment, and I ended up living with Dave like 3 days a week, and sleeping in my car on the weekends and
Mhm.
delivering pizza. I was doing that for almost a year, and now I got a job in Chicago, a delivery service, so I'm not living with Dave 7 days a week. So it's been a real struggle for me to get through these last couple of years, because I know that if I had gotten good help early on in my life, things would be
Different.
so much different. What's happening now in the community where your clinic used to be?
Well, I sometimes see my patients wandering around, not
Mhm.
doing well. I'm convinced, because they're predominantly black, they're in Cook County Jail.
Mm-hmm.
Some of them are in clinics. The ones that I saw, I think I got them to where they needed to go.
Mm-hmm.
I have no idea what the state did for them. It's funny because I started recently working again at St. Bernard's Hospital, and I'm seeing people at St. Bernard's Hospital that used to be patients at our West Side office on 62nd and Western.
Mm-hmm.
But because it got closed, there's really no safety net.
Mm-hmm.
There's no backup for those patients. So they're bouncing in and out of the hospital like rubber balls, which is not good.
Right. I read this article in the newspaper online. It was last September. Cook County Sheriff Tom Dart said, I'm the largest provider of mental health services in the country.
Sure.
What do you think he meant by that statement?
Los Angeles County Jail and Cook County Jail are the largest state hospitals in California and Illinois. It's unfortunate.
Yeah, because I always wish that the government would spend more on mental health care.
I wish the government would spend more on prevention.
I was reading recently from NAMI organization.
NAMI, yeah.
They said like mental health gets about 6% of healthcare spending, according to the American Journal of Psychiatry. But the journal estimates that a staggering indirect cost of perhaps $200 billion a year nationally. What needs to be done to help the uninsured and the poor?
Well, I think we need to put Obama's national health insurance in place, A. B, I think we need to focus on prevention technology and innovation. I was a member of the 2009 Institute of Med and Prevention report. And in there, there's hard, solid science that you can prevent depression, you can prevent substance abuse, you can prevent violence, maybe you can prevent schizophrenia, you can prevent postpartum depression, which is a huge destroyer of early childhood development.
Mm-hmm.
I've done a lot of work on
Mhm.
children exposed to violence.
Mm-hmm.
And in 1976, when I saw a 4-year-old girl who had seen her mother get stabbed to death,
Mm-hmm.
which is pretty traumatic,
Right.
I went to the literature to try to find out what I should do for this child. And there was a sentence by Anna Freud which talked about when Germany was bombing London. She noted that if the parents of the children were doing okay,
Mm-hmm.
the children did okay.
Yeah. Why did you decide to get involved in psychiatry?
The reason I went to psychiatry is sort of a long story, but I'll try to make it short. I've always been confident,
Mm-hmm.
aggressive, and arrogant.
Mm-hmm.
So I do things. And when I do things, my entire life, people tell me I was crazy.
Mm-hmm.
Well, I have enough sense to know that if 5 people tell you the same thing, you should listen to them.
Right.
So I thought I was crazy all through growing up.
Mm-hmm.
Now, that didn't stop me from doing what I thought I should do.
Mm-hmm.
And to some extent, I'm self-made.
Mm-hmm.
So I go to medical school because I want to help people. I really like helping people. And I was doing surgery, and I said something to the head of surgery in the middle of surgery. And one of my medical school colleagues came to me the next day and said, "Bill, you're crazy. Why would you say something like that to Matthew Walker, the head of surgery? Don't you know that he could have just squashed you like a bug?" Because he may have thought you were challenging him.
Mhm.
I really wasn't. I was asking him a question. Well, I was eating lunch with a psychiatrist, Dilla Arthur, who
Mhm.
said, "Why are you calling him crazy?" And the guy said, "Well, because." He said, "Well, because what? Is he out of touch with reality? Is he psychotic?" And the guy said, "No, Bill's usually pretty down to earth."
Mm-hmm.
He said, "Well, what did you mean?" He said, "Well, he's arrogant, he's cocky."
Mm-hmm.
And I thought, my God, why can't people be more precise with their language? I knew that, so I
Mhm.
dropped psychiatry like a bad habit
Mm-hmm.
and decided to go into surgery because I'm a surgeon. So I was doing surgery, having a great time. But when I was ready to finish medical school, what I realized was that the only thing I didn't understand was psychiatry,
Mm-hmm.
because I couldn't figure people out. And so I decided rather than go for the specialty that had a ceiling or a floor,
Mm-hmm.
I decided I would do psychiatry, which
Yeah.
is limitless.
You're right.
So I went for the adventure.
Oh, yeah. Yeah, I do a lot of hiking and backpacking and cave exploring too, and that's really helped my life enormously, is just to get out there in the wilderness.
It's peaceful.
And explore. Exactly. It's peaceful, and my OCD goes away, and I just feel really calm, and I've made some great friends through caving, and it was like 4 years ago I took this solo kayak trip down the Green River through Canyonlands National Park
Okay.
for 5 days out in the river in the desert wilderness. And it was like I was out there alone, and it was like the happiest time in my life. And for those 5 days, it's like I had no OCD, I had no depression.
See?
Yeah.
If you had had a strength-based approach
Mm-hmm.
when you were 13,
Yeah.
14, and they had discovered that strength, that love,
Yeah.
you could have been a forest ranger. You and Smokey the Bear could have been out there.
Yeah, I would have loved that. Do you think that would work for people with other mental health issues?
I think if we paid more attention to people's strengths,
Mm-hmm.
if we paid more attention to what helped people to flourish
Mm-hmm.
and recover, and took an acid-based, strength-based approach
Right.
to people, rather than oh, you're sick, oh, you've got this diagnosis, oh, you've got this, oh, you've got that. People would be a whole lot better off.
And when I joined this caving group too, I learned people taught me how to do vertical caving with ropes and climbing gear and stuff.
Oh, really?
And I've done a lot of deep pits and caves. And when I learned all that, other people started coming to me
Oh,
to teach them how to do it. And suddenly I was like, well, people are coming to me for advice.
so I refer to that when we did our violence prevention research and our HIV prevention research. We discovered something called, well, we didn't discover. We identified something called self-esteem, which is a sense of power.
Mm-hmm.
So you got a sense of power from teaching people,
Mm-hmm.
a sense of models. You know how to do the ropes and
Mm-hmm.
the little clips or whatever those, I have no idea. You also developed a sense of uniqueness.
Yeah.
And you were able to connect to people, and that gives you self-esteem, which is a strength,
Right.
and it counteracts all the other stuff.
Right, it goes away. Because slowly I've been telling people in my caving group about my OCD, and the responses have been overwhelmingly positive.
Well, probably NBC, you know what that
Mhm.
stands for, right? NBC?
No.
Nobody cares.
Oh.
As long as you don't drop them or leave them in the cave.
Yeah.
You know, first
Yeah.
things first.
Yeah.
As long as you're competent at what you're doing,
Yeah.
what's the problem?
Yeah, I discovered in my caving group that there was actually other people that
Aha,
had.
see? And they were walking around not telling anybody and
Yeah.
ashamed.
Yeah. I was trying to find a psychiatrist on the north side to renew my prescription. And I'm sitting there in the waiting chair, and all of a sudden I see one of the guys from my caving group walk in, and that was just really awkward. I didn't want him to see me at first, and I was like hiding in the corner, not looking, and finally I said, oh, what the hell? I have nothing to be ashamed of. And I went
Well,
over
you
and
know,
shook his hand, and
It is what it is.
yeah, and that's what he pretty much said.
You gotta play the cards you're dealt.
Yeah,
The issue is, do you try your best? What about exercise? Does that help? Do you know?
yeah, it helps a lot, and that's something that I need to do more of. But a lot of times I feel depressed, and because I've been worrying about this interview too for the last few days.
You'll live.
Yeah, and
You'll live.
my therapist, like she said to me, she goes, "You've done this before, you'll get through it."